when a child has had an injury and there's a suspicion for bone fracture, that's not the time to massage that joint.
Hello everyone and welcome to Pediatrics To-Go today. So today we have Dr. Sanusi. She's going to be talking about upper limb fractures, particularly elbow and wrist. I'm Francisca Lename, your co-host, and on to Dr. Sanusi to enlighten us as usual on pediatric topics.
Thank you, Francisca. So we're talking about injuries and fractures of the upper extremity today because that is one of the major reasons that children visit the urgent care. And when children are doing any kind of activity and they're tripping, the first thing they do is put their hands out to prevent them from falling. So when they hit the floor, they could either have injuries of their wrist or their elbow or even their shoulders. We do see more commonly wrist fractures, and elbow and shoulder fractures are less common. And that's because the whole weight of the child has been supported on that wrist to prevent them from falling. So when a child comes in and they've had a wrist fracture, there's usually a typical history of a fall, breaking my fall with my hand, put my hand out. And sometimes children come in with obvious deformity of their wrist. They might have significant swelling of the wrist, or they might have the wrist looking like out of place or out of shape. And they usually come in severe pain when they have obvious deformity of their wrist. Now, what we recommend is when a child has had an injury and there's a suspicion for bone fracture, that's not the time to massage that joint. Sometimes if a child has an injury of the elbow can be so swollen. And remember, most upper extremity injuries, fractures, you have your vein, you have your artery, you have your nerve. And if someone starts to try to massage or trying to pull the limb or trying to do anything to that upper extremity, or even any fracture, any time you have a broken bone, you could end up lacerating or ripping apart the nerves of that hand, or you might end up cutting the blood supply because you just tried to massage and the broken bone lacerates or cuts the vein, artery, or nerve, and you don't want to do that. So anytime there's an injury, there's a natural splinting where the child is holding onto the hand because of the pain. And because they have so much pain, they can't move it. Don't try and get your child to move it. Just go get an x-ray and go to the nearest facility that has an x-ray, get that x-ray done. And if it's broken, then you want to see an orthopedic doctor. But when children come in with obvious deformities into our office, first thing we do is pain management. So we either give them ibuprofen, and if the injury looks quite severe, we give them strong pain medicine because comfort is very, very important. So you give strong pain medicine, then they go for x-ray, and then we do a splint. And there's different ways to splint the extremity that is injured. If a child has a broken bone, then you want to put a cast, but a splint is just a way of comfort, giving comfort to the joint that's broken until you see orthopedics. So it's always safer to have it checked out sooner than later. Sometimes you might think it's not broken because the swelling is not that bad, and sometimes it is broken. So it might be very swollen and not broken. It might be have very little swelling and it's broken. So the amount of swelling is not necessarily an indication of how broken the bone is or if the bone is actually really broken, but it's always safer to do an x-ray, and the x-ray will tell you if there's a fracture or not. So what we usually recommend, if your child has significant swelling of the wrist, elbow, or shoulder, please get it checked out, because there's what you call the brachial plexus that comes all the way down, and then that is what controls our fingers and our upper extremity. If you start massaging it and you tear the nerve, that child might end up being deformed for life, and you don't want to ever massage any injury. You want to splint it. You can make a homemade splint where you get a scarf, make it into a triangle, and put the edges around the child's neck, while the middle part of the triangle stays underneath the elbow, just to splint and hold, and then just hold the the child's hand against the body, and that is a way to minimize severe pain after an injury. And then once you get to the hospital, they'll be able to take care of the child. And then you want to see an orthopedic doctor, especially if there's a break in the bone.
So sometimes I see children when they have the bandage around their arm by their neck and they have like the stick. What's the purpose of the stick?
Now the stick is a homemade splint because it's giving the joint some support. Yes, once you have support, like if I have a broken wrist, I hold my wrist like this just so that I'm not swinging it around because it's too painful to move it around. So a child will do this or hold their wrist like that. And the reason is because, first of all, there's too much pain when there's a broken bone. And then second, you don't want to be moving it so that the pain is not replicated. Once you're not moving it, the pain is less.
Stays, isn't it?
It's less. But once you start moving it, then it hurts. And what we usually recommend, if there's no broken bone on X-ray, what we recommend is, if it's a sprain is where there's just an injury to the ligaments and the soft tissue of around the joint, then that's a sprain. Well, there's two types of, there's a strain and there's a sprain.
Sprain, yes.
Now the strain is usually the ligaments are bruised, and then a sprain is the muscles are bruised. So you don't have to you don't have to know all that. That's for me to know. But the bottom line is, if we do an X-ray and there's no fracture, what we recommend is 1 week of rest. So if that child plays football or basketball or soccer, you need to be 1 week off if there's no fracture. Most fractures in children, once a child has a fracture, they are put in a cast. The cast and a splint are two different things. Splints are just temporary, casts are permanent, and most bones in children will heal in about 4 weeks. Now, old people...
I was going to ask about the healing process.
Old people, when they have broken bones, remember, children, their bones are still fresh, and there's a lot of vascular supply to the bones, and they're just nice, and it's like a tree, a fresh tree. So when there's an injury to that bone, it heals in 4 weeks for children. But old people and older people, it takes up to 6 to 8 weeks. So where a child will heal in a month with proper care, and adults might take 2 months to heal. And that's just the way it is. But in general, once you have a break in your bones, see the orthopedic doctors. I tell parents, I said, Mom and Dad, we're only putting this splint on in the urgent care because it's temporary and it's just for comfort. See orthopedics and they'll be able to give you a cast. The cast is much stronger than a splint. And those are the ones that you can have different colors, pick the colors that you like.
Yeah, you have your friends sign up.
And have your friends, exactly. And those are the ones that are usually fiberglass. In the past, we used to do plaster of Paris, which look like cement. I think when people say plastering the wall, I'm thinking plastering cast. Those days, they used to do all that. But now they have the fiberglass splints. And those are much easier. They're lighter and they look, they're more aesthetic and appealing to children when they have fractures. So see orthopedic doctor. Usually they'll follow the child for the amount of time that it takes to heal the fracture. And once the fracture is healed, everybody's happy. Then the child can go back to doing their regular activity. But if it's a sprain, and we tell parents, if there's no fracture, we've done X-rays, there's no fracture, we tell parents, let the child be out of PE, so no football, soccer, or basketball for 1 week. After a week, if a child still has pain, there's something we call an occult fracture. Now, an occult fracture means there's a break in the bone, but we don't see it. It's kind of like when you have a bruise and your hand is paining you, and about 2 weeks later, you notice that,
occult blood.
There's a bruise. I have a 2 or 3 days later, I have a bruise, and that place was hurting. That means, it can take time for an occult fracture to show up. So you do an X-ray the first day of the injury, and there's no fracture. And then you now do another X-ray after a week where the child is still complaining of the wrist or the elbow hurting. And then there's a fracture healing. And there's one, it's called callus formation, which is new bone forming to heal that area where there was an occult fracture that wasn't picked up in the initial X-ray. And then you know that, okay, this child had a break. That child needs to be on to use a cast or see orthopedic so they can put a cast, and needs to be out of physical activity for 1 week. So for 1 month.
Okay, sorry. Is it possible to feel numb when you have a fracture? Because I know, talking about this, I've had a fracture before, but I didn't feel, it was like lower limb, but I didn't feel anything, my knees. So is it possible? But I couldn't walk. It was like I was displaced. Like my upper limb was detached from my lower. So I was in the hospital for weeks. I fell on my knees. I don't know. I was late.
Which bone did you break?
My knees. Oh. So I didn't feel any pain. I just couldn't feel anything. So I tried to walk. And then I couldn't. So that was when the doctor told me to try to walk from the entrance to the seat. And then I just took a step and I just fell. So I just remember that what kind of fracture is that? Is that a fracture? It's like detachment? I don't know.
When you have a fracture, remember that the nerve can get lacerated. That's the extreme. But sometimes the nerve, just from the swelling in that joint, the nerve can go numb just because of temporary bruising of the nerve. So your extremity might feel different. If you have an injury in your right hand and you don't have in the left, your right hand will feel different from the left. And that's because the nerve gets swollen or bruised and it's not as effective, or it's not a transmitting nerve transmissions of basically neural activity. And once the swelling goes down, all the numbness and the tingling or the difference in the feelings in the hands, it goes away.
Wow.
So there's a name for that. It's all medical, but it's beyond the scope of this talk. But definitely numbness goes with injuries. And even if you don't have a fracture, you might feel numb in your fingers. But if you cannot move your fingers, most times when we're doing an exam after a fracture, we talk about neurovascular status. Is the nerve and the vascular status of the child? Does the child have a good capillary refill? You check and see if there's a good blood flow to the extremity. As long as the child is moving his extremity or her extremity, you know that, okay, neurovascular status is intact. So anytime we report or we write a note about a child having an injury, we talk about neurovascular status being intact or not intact. And if that child cannot feel his extremities or her extremities and does not have a good capillary refill where the blood flows back to the fingers quickly, then that child needs to go to the hospital to see a orthopedic doctor and possibly a neurologist to be evaluated properly. So they need to see the appropriate doctors for that.
Oh, wow. Thank you very much, Dr. Sanusi. We come to the end of today's session, which is upper limb fracture. So until next time. So see ya. Bye.
Bye.